Hello, this is John Kanellopoulos. Happy New Year to everyone back in the New York, from the New York office rather, into our center in Greece. This is our first week back in 2024. And of course, our favorite subject, normal cornea, normal high astigmatism, or keratoconus. Let's see a couple here that we saw today. Quite impressive. Both of them hyperopic. Let's go first see the gentleman who happens to be a physician. He's 51 years old, and this is the cornea. Now, thinnest part of the cornea, 447. Anterior, posterior elevation look perfectly normal. Topography looks normal. Is this keratoconus? Let's look at the other eye. Same patient, the other eye. Very similar. Almost normal, total cornea curvature. Remember on the pentacam map, this is not anterior as it is noted here, but oculus. This is total cornea power. This is the posterior cornea power that is 6.34, so a little bit higher than normal. But very thin cornea, thinnest here is 453. 2 diopters hyperope, average keratometry 43.4, so we know this is about a 22.5 millimeter eye in actual length. In my opinion, this is not keratoconus. We're seeing the outer edge of normal, a thin cornea, good anterior and posterior elevation, very little angle kappa on the vertical axis that explains the lower apex of the cornea. It's the Y deviation. Let me zoom it up a little bit here. It's 130 microns where the X is just 90 microns. And surprisingly, once I've explained all this to our colleague, with the wife being present, who was also wearing a +2 trial contact lenses, we went on to see the wife's corneas. And this is what we saw. And sorry for me smirking, because the wife has thicker corneas, 501 microns, but as we said before, the pachymetry distribution is classic for keratoconus here. Angle kappa is 50 microns on the, 500 microns on the x-axis, 100 microns on the y-axis. So this explains the angle kappa that we're seeing here with the pachymetry deviation, but there's a lot of steps and there's very rapid change in the cornea thickness. There's truncation of the astigmatism, irregularity upper lower. It is evident also the posterior cornea curvature is far steeper than the anterior. And I know what you're thinking of right now is epithelial maps will get there. The other eye is worse, more truncation, thinnest cornea 495. And again, less angle kappa here, 460 microns on the x-axis and 70 microns on the y-axis. And if we look at the pentacam assessment, sure enough, it flags the right eye as keratoconus stage 1 with an IHD of just 0.017 and with an IHD of 0.019 on left eye, also keratoconus stage 1, although the ISV is far worse on the left eye and the IVA. Facts that we've talked about, we've published, and shows that although the Amsel-Krugman criteria on the pentacam are helpful, they're not doing justice here of the difference that's seen between the two eyes. That's quite evident. And of course, you were thinking of epithelial maps, which this is the right eye, and we can see that the cone is inactive. So it is not currently a clinical issue for this patient. Of course, we want to see the two sons of the couple. One is 16 and the other is 20. The other eye, the thickness maps with the Avanti OptiView, now Visionics OCT shows that there's an abrupt change of thickness, or in my opinion, higher stage of keratoconus, which is from Frusto because the epithelium is naive. This patient is obviously not sleeping head down and not an issue for her. Of course, the tasks remains, what do you do for laser vision correction? A 50-year-old lady that has a cornea like this and has a hyperopic prescription of +2. The average keratometry here is 42 almost diopters on the right eye, 42.5 on the left. again in suit that these are hyperopic eyes with relatively steep corneas though. So probably much shorter than average than what their hyperopia reveals. So my opinion here, we'll discuss, of course, a lens-based procedure. There's not enough room to do an ICL, but a lens extraction will be an option here, as would be a transepithelial hyperopic PRK in both of them. And we're trying contact lenses on to see how blended vision works with these patients and make a decision based from there. Thought you found this interesting. Let me go back into unzooming so I can get in the picture. How exciting it is to look at cornea diagnostics and try and ascertain what is keratoconus and what is not. In my opinion, the spouse, the wife, definitely has keratoconus. The husband is on the outer edge of normal. It'd be very interesting to see the pentacam maps and ideally epithelial maps of the two sons that this couple has. Happy New Year to everyone. This is our keratoconus grand rounds for today and the first one for 2024. Thanks so much for watching.